Wow, that's pretty hard to follow up right there. I really wish you guys can take that in consideration because that's a strong testimony right there, Ms. Echohawk. I very much appreciate that coming straight from the heart. Thank you. Do I? Good afternoon, Chairman Simpson, Ranking Member Pingree, and respected members of the committee. I'm Conrad Jacket. I serve on the governing body of the Albuquerque Indian Health Board. I am from the Umanu tribe. I am also an elected member of my tribal council. Thank you for inviting me to speak, and thank you for your continued dedication and hard work to support Indian country. We have submitted written testimony that details our federal funding needs for fiscal year 2027. AAIHB is a consortium of several federally recognized tribes in New Mexico, southern Colorado, and eastern Utah. We consist of the two bands of Navajo, Tahajole, Rama, the two Apache tribes, Muscogee and Jicarilla, and the two Ute tribes, Southern Ute and Ute Mountain. We also provide healthcare services to citizens and other tribes throughout New Mexico, southern Colorado, Utah, West Texas. Our tribal organization is entirely funded with federal dollars. About a third of our funding comes from IHS. As we all know and have heard from tribal leaders, IHS has been underfunded for years. Although we appreciate the committee's efforts to protect and preserve IHS funding, we ask that Congress find new ways to increase IHS funding. At the very least, we urge you to ensure that IHS funding is increased to keep pace with inflation. We greatly appreciate Senator Kennedy's strong support for IHS. Today, I'm here to tell Congress that without increase to the 2027 budget, healthcare programs throughout Indian country will face across the board cuts. This is due to the rising cost from medical inflation, as well as more and more patients using IHS or tribally contracted clinics. Our existing funding is simply not enough to cover our current programs, let alone absorb more cost. For example, my organization has contracted some services from the IHS on behalf of our member tribes, including audiology. We are the only provider of hearing services for many of our rural tribal communities, which includes elders, veterans, and children. We ask that Congress increase IHS funding so that we can continue to provide essential healthcare services that Indian country relies on. We also ask that Congress continue to protect, preserve, advance appropriations for IHS. We thank you for repeatedly serving advance appropriations. This area of bipartisan agreement will allow us to provide stability for our staff and patients. We ask that Congress continue to provide advance appropriations going forward. As the administration carries out realignment efforts within IHS, we strongly urge this committee and Congress to ensure that funding for IHS remains a priority. We ask that this committee ask to ensure that IHS programs are fully funded. In particular, we ask for fully funding for the Division of Epidemiology and the Center Prevention, Tribal Epidemiology Centers, Special Diabetes Programs for Indian Communities Health Representatives, Division of Behavioral Health, Injury Prevention, and the HIV, HCV, STI program. These programs provide critical services and are very valuable to tribes and tribal organizations throughout the nation. Put simply, these programs save lives. Lastly, we recognize Medicaid is not directly under you guys. We ask that the members of this community continue to fund Medicaid with expanded coverage for American Indians and Alaska Natives. This provides additional and much-needed resources to not only IHS beneficiaries, but also for our tribally run and operated healthcare programs. Before I conclude my testimony, I'd like to say on behalf of AIHB, Albuquerque Indian Health Board, we are very thankful for you to continue your hard work that this committee does year after year to help promote and for the safety and health of Indian country. We urge the committee to continue that work by safeguarding and finding ways to increase the federal funding that Indian country relies on. We truly appreciate this committee's hard work, and I would very happily be grateful to answer any questions. Thank you. Duwish Duyak.